and the course of my life forever. So I'm happy to confirm that 7 years later, I'm cancer-free. Dr. Nii Adekeye, my co-founder's father, had passed away from prostate cancer in 1998, 16 years prior. And Mrs. Sonia Ali, who is a trustee and a very close family friend, was a 33-year cancer survivor. At that point in time, things were lining up. We did not see the link. I got back to Nigeria after my treatment, and we decided, why don't we have a look at what would it have been like if I was ignorant, or if I didn't have access to medical care, if I didn't have insurance, because as we know, cancer is expensive. Thank God I had insurance. And we spent several weeks visiting government hospitals, Luth, Lasuth, talking to patients, talking to doctors and nurses, because we forget the doctors and nurses. They are also victims in this cancer thing. It's not easy to have patients who come to you late that you're going to tell that there's no hope. So the doctors and nurses are carrying burdens that nobody should have to bear. We discovered that people were emotionally exhausted, financially exhausted, physically exhausted, and the cancer was affecting everybody. Some people were abandoned by their families. We had girls who, at the consultation room with their fiancé, they were told they had cancer, the fiancé was going to buy a recharge card, the brother had disappeared. And that's what happens. People are being abandoned as a result of it. What was clear to us is that cancer does not only affect the patient. It affects the families, it affects the friends, it affects their caregivers, it affects us, the doctors, the nurses, and even the communities. We have to do something about it. So our very, very first project, not as an NGO, but as a company, Bricon Global, was we refurbished the Luth Oncology Department. This was in 2015. And what did? We went in, we repainted, replaced furniture, we put in new drip stands, put in air conditionings, fixed the plumbing. And when we saw the impact, and it was funded by APM Terminals, and when we saw the impact of simple things like that, making the environment conducive, the patients' spirits changed. The sweeper was singing as they were sweeping. It changed everything, and that was the day we decided that if we're going to make an impact, it cannot be a CSR project. We would have to set up a platform from which we would not be chained, politically or otherwise, to talk about cancer and approach it from a much more holistic point of view. So in 2016, the Bricon Foundation was born to support, care, and help cancer patients and their families. We don't only focus on the patients, and that's a really important part of what we do. We realize that the patient comes with an entire support structure, and if you do not take care of the families as well, then you're going to run into trouble. So how do we help? Providing survivor support is absolutely crucial through every single stage of the cancer journey. So we have a support group for women called the Bricon Whole Woman Project, and this provides one-on-one counseling. We do a lot of seminars. Women encourage each other, they share their stories, and this has been a really useful tool for women to get out there and not be ashamed. There's still too much stigma associated with having a cancer diagnosis. We also set up our H4H project, and that's the Help for Husbands project. We realize that very often we forget the husbands. The husband is the one who is not supposed to cry because he's supposed to be a man. The husband is the one who sells his land, sends his furniture, sells everything he has to keep his wife alive, and his wife still dies. Our very first meeting that we had, we weren't expecting anybody. We had 11 men. And these men wept openly. For the first time, they felt safe to talk about how they felt. And so the Help for Husbands group is there for men to support men. And not just husbands. There's sons who, by default, have suddenly become fathers. They've suddenly become husbands. So it's any man who is in a position where he's having to take care of women folk who have cancer, of course, the man who has the cancer himself. Another aspect that we also provide is patient navigation. Everybody will tell you that this cancer journey is complicated. Just go to a standard hospital, you don't know where to start from. So it's really important that you understand the journey and the process. That's a very important part of what we do. We also discovered that cancer patients generally don't get to eat properly. So you tell them, oh, go and eat a healthy diet. Please make sure you eat well. This person can't afford their treatment. They generally can't afford the food either. And we had patients that we were paying for blood transfusions for. And we sat and thought about it. Look, why not give them blood-building food? Why not give them the beans, the green plantain and everything else? and feed them and their families, because if you give the mother the food alone, that food is going to those children. So we started setting up temporary food banks. When we had the food bank in place, the women no longer needed blood transfusions. And it was a lot cheaper than paying for blood and a lot healthier. Still on the subject of feeding, it is important in the times that we live to adapt. So during the COVID period, thanks to a very kind donation from the Nigerian doctors in Ireland and some donors who refused to be identified, we were able to give financial palliatives to 13 families over a period of 2 months. So you can see we keep on trying to adapt based on what is absolutely necessary. And I think that one of the greatest achievements has been our provision of mastectomy wear. That's breast prosthesis and silicone breast prosthesis and mastectomy bras. We had 4 women who chose to die rather than take their breasts off because they felt that without breasts, they were no longer women. This became a critical situation. And God is always so kind. I went to Nicola Jane Boutique in London to buy my own prosthesis, chatted with the ladies there, and I walked away with over £3,000 worth of free mastectomy products, mastectomy bras and prosthesis. 158 units. We helped 158 women immediately. And since then, thanks to the kindness of Melissa and her team, we have been able to provide prosthesis and mastectomy bras for over 500 women to date. And we continue to try to do our best. True Life Dublin recently joined us as well, and they are also donating silicone prosthesis. 100 mastectomy bras were also donated to the Luth Breast Clinic. Something that's often neglected with children is education. What we discovered that many of our children were sitting at home because no money for school fees. And one thing we're very careful of is that you can want to try so hard that you end up doing too many things and you don't do anything well. So we started a Keep Kids in School project. And what we discovered was that if you keep the kids in school, you're saving another generation. But we needed to find a partner. It was not our purview, we're not educationists. Thank God for the Lebanese ladies. The Lebanese ladies stepped up to the plate and they're currently funding 13 children up to university. And they have been amazing. From time to time, they'll call up, Abigail, by the way, do you guys have any more students? We have money. Oh. They've been absolutely really amazing. So what's important is that we partner with other NGOs. You cannot do everything yourself. You will break. Oh. Then the other thing is training programs. You remember I talked about how doctors and nurses were struggling under the weight, how there was no support structure. We were so blessed. We met Linda Thomas, who's the CEO of Macmillan Cancer Support in Paris during a cancer conference. And we asked her, would they be able to assist us with material? She said not only that, she would give us 3 alumni nurses, specialist consultants, to work with us to develop a training program for Nigeria. And thanks to their support, in the first maiden edition, we trained 100 doctors and nurses from 46 establishments, both government and private. And since then, we have trained 300 doctors, nurses, and healthcare workers, and we hope that we'll be able to train an additional 200 this year. Celebrating cancer survivors is also extremely important because many cancer survivors don't feel good about themselves anymore. Thank God for the young ladies in our midst here, and I will mention them, Sharakwa and Blessing, who are very dynamic. And they're both cancer survivors, and we decided to have a party. The very first party that we had was with Judah Foundation. We had probably 60, 70 women. The one we had in 2021, we had over 80 cancer survivors under the same roof, taking pictures, holding signs, sharing their stories, getting free photo shoots, and not being ashamed. We had such a blast. It was such an amazing day. And this is something that we plan on continuing every year and increasing it not just to have breast cancer patients. You find that women generally are more prepared to talk than men. We're hoping and praying that our next edition, we will get men to come as well, that men will also talk about it because men don't talk. And that's why prostate cancer is killing our men. Colon cancer, because man is being a man, he can see symptoms though. But they say, oh, well, it's not, it's just stress, it's just this. So we're hoping that in the next edition, that will make it bigger and better and have men not being ashamed to come out and talk. Now to the main, to the cocoa of our business today. We chose to do financing of cancer patients. And a lot of people think, oh my God, do you understand what you're doing? How long is a piece of screening? Everybody screens. Screening is wonderful. Happy clappy. You screen 500 women. What happens to the 10 who were found to have cancer? Who's going to pay for their treatment? We had one woman. She was a market seller selling tomatoes who was coming to us from a free screening program. She had a scrunched up piece of paper in her hand. She had HER2 positive cancer. Herceptin is probably around 350, 400,000 per dose. They wrote down for her 18 doses of Herceptin. That was around the 8, 9 million. They wrote for her surgery, whatever it was. Her bill was 12 million naira. And she came to us with a bill of 12 million naira. What we are told is that, can she please go and get a medical report? We didn't see her again. That woman's going straight to the village to deal with the arrow that has been dealt to her. So it's not enough to screen. I want to use this opportunity, please, out there, if you're screening, please keep some money for treatments. If you're going to help to diagnose, please help to treat. We all need to put hands together for this. What's really important for us is, like I said, we do not discriminate in stages of cancer. Everybody has a right to dignity in life and quality of life, and of course, dignity and a pain-free death. So we do not discriminate in stages. We've had people who come to us end stage. Obviously, you would like to get lots of early cases, but whether we like it or not, that's not our Nigerian reality. It's not. If you're waiting for stage 1 or 2, you wait long. Because the bulk of the patients, probably 80% are coming 3 and 4. That is our reality. So we cannot pick and choose who we're going to help, because cancer didn't pick and choose. They didn't want to get cancer. So what we believe that it is true that cancer can be really expensive. However, when it's got early, and we have seen some early cases, it can be very well managed. And I've met women stage 4 with brain mets. 12 years later, they're still alive, which shows you can still live with metastatic cancer. Things have moved on. So even if you're stage 4, it does not mean you're going to die. So let's not give up on our loved ones. Let's not say we are wasting money because it's stage 4. Don't waste your money. My mother, 33 years, she stayed on. 33. The doctor that told her she would die died before she died. That is the reality. So, over the past 5.5 years, we have partnered with and received donations from lots of companies and individuals who have made our job possible. And thanks to them, we've raised money for over 100 patients for medication, surgery, diagnostic tests, chemotherapy, and radiotherapy. And we believe that with our funds from this campaign, we can provide the much-needed treatment for 5 of our patients currently undergoing treatment who we need money from, and of course, the many who are waiting for support. The COVID pandemic greatly affected us, as it did most people, because everybody's resources now went to COVID instead of cancer. But so as the world emerges from the COVID pandemic, because it's not really going to go away, we're just going to live with it. Let us not forget cancer. Cancer is still the front burner, one of the leading causes of deaths in Africa. And that's not because we're having more cancers, it's because we're not treating it on time. America, the West has a lot more cases than we do, but they're having less mortality because they're getting it on time. We need to get it on time. Self-examination, check yourself. Don't ignore symptoms. Don't rush off to the prayer house. I'm not saying prayer is not good though. If God is going to heal you, let him know how to do his job. He will tell you how he wants to heal. I would have loved an angel to drop from heaven and said, be thou healed. But I was healed in the hospital and I'm cancer-free now. So please, let's not pick and choose. Don't wait until your life is in your hands. Remember, cancer does not discriminate. You may think out there, oh, my donation is too small. I only have a small shop. I only sell tomatoes. I only sell this. Or you may be a big multinational. We don't mind millions though. But the reality on ground is this. I calculated. Lagos has 20 million people. I'm going to do some mathematics. If 100,000 Lagosians give 500 naira, that is 50 million. Let's do the maths. What does that mean? It means if 10,000 people give 5,000 naira, we've hit our target. Are you telling me in Lagos alone we cannot hit 50 million? I believe we can. So as we go into our program, I urge you to be a part of the change that you want to see. We have to close this gap. We don't know who's going to be next. Science can tell you the risk factors for cancer. Science cannot tell you you will definitely not get cancer. So the brass tacks of the issue is next time, it could be you. Thank you. Okay, at this point, we're going to ask 3 survivors to share their story. And I think this is important. It's important because when you talk about cancer funding, you never see anybody coming out. So you say, okay, it's very good, you're supporting all this. Where are the people that you're claiming that are... So I have 3 very brave ladies who are going to step up and share their stories. And they're not going to say a lot because they really don't want to say too much. But I think it's important that we realize that the work we're doing is important, and we are supporting real families, real women, real children. So I'm going to ask young Anita to come forward and just briefly tell us a bit about yourself. Mommy, you want to go with her? Mommy, do you want to come with her? Okay.
Good evening, Maz, and good evening, Saz. My name is Ejimado Anita. I was shocked to be diagnosed of cancer when I found out I was diagnosed of cancer. So my parents went to Bricon Foundation for help, and they have been helping us up until this moment with the treatment and every other thing. And also from the help from my church, they have been treating me from this cancer. So I want to implore you to help them so they can help people like us with cancer. Thank you as you help.
I would also like to call Bimbo to come up and share her story. Are we good in terms of video? Okay, wait.
Good evening, ladies and gentlemen. My name is Dada Bimbola. I'm 32 years. Okay. I'm 32 years with a daughter. So I was being diagnosed in 2019. I just had my baby then. So I and my husband, we approached Bricon for the finance, and they have been a great help since then. So I'm done with my treatment now, and there's no traces of cancer. So I'm hoping to live a great, healthy life. So employees can help them so that they can help others who are also in this. Thank you very much.
And I have one more young lady, Kenny Olusoji, who also will share her experience.
In 2019, stage 1, 2 positive. So all through the journey, I've been so fortunate to be under the financial support of Bricon Foundation. And to this moment, even though I've not finished my treatment because of inadequate of funds. So, but I believe that with this campaign, we can be able to raise something from you people, and may God bless you, and thank you very much.
Thanks very much, ladies. We really appreciate your sharing. It's really important that we put faces behind the struggle with cancer. At this point, I'd like to invite Her Excellency, Toyin Saraki, to please join us. Thank you so much.
Good evening, everybody. I hope you can hear me. I've been told I don't have a very loud loud voice, so please just give me a thumbs up or something if you need me to up the volume. First of all, I would like to recognize and commend my dear friend and sister, Abigail Simon Hart, who I can't get used to this Simon Hart. I still think of her as Abigail Ikwe because we were in primary school together. Dr. Ni Adekeye, Dr. Umar, and Auntie Sonia Ali. It's really about the battle to close the care gap. And I want to thank you all, actually, for being here on a Sunday evening. My name is Toyin Ojora Saraki, and I'm the founder and president of the Wellbeing Foundation Africa, which works to improve health and social outcomes for women and their children. And it's a cause that I've actually dedicated most of my adult life to. I'm honored to be here at the Bricon Foundation's fundraising campaign to highlight and to advocate for closing the gap in cancer care. And I should probably tell you how I came to this journey. Some of you might recall that once upon a time I used to be a First Lady of the State in North Central Nigeria, Kwara State, 2003 to 2011. And because I was doing so much in health, I kept getting letters from organizations wanting me to match funds with them to do cancer screening. But I'm a very, very diligent person. As you can see, I even arrived with over 100 pages of my own research. And I'm not somebody who does tokenism, actually. So when they kept asking me to do cancer screening, it was either breast cancer screening or cervical cancer screening, I immediately sent for the Commissioner for Health and the heads of the two main hospitals in the state, the federal facility, University of Illinois Teaching Hospital, and the state government specialist hospital, SOBI specialist. And I said, can you treat cancer? And they said, oh, well, we can treat stage 1, and there's all sorts of things we're using now to treat. There's a lot of innovation in treating stage 1, but they could not provide radiology. And then so I would be comparing it to this letter that had been sent of, everybody wanted to screen 5,000 people for me and 10,000 people for me, and they always wanted to come into the state for 2 or 3 days to screen whoever they wanted to screen. And I said, look, you can't expect me, knowing that 22% of the world's population does have cancer. You cannot expect me to herd women into a hall or field, or men or children, and then you will diagnose cancer, and then you will go away and leave me with them. So I used to dodge. I used to dodge cancer screening programs, and I don't even pretend. I kept blocking it, and I was doing the things that I could do: malaria, deworming, safe childbirth, because I did not have the courage to look somebody in the eye and say, something, you have cancer, but I can't treat you, and shrug my shoulders and walk away. And that actually led in 2010. I harassed my husband so much that he established what they called then the Kwara State Advanced Diagnostic Center, which actually could treat. But just the sheer cost of that program, some of you who are experts may know it, nobody believed it was for real. They actually thought my husband was doing a white elephant project to steal. And it was fully equipped and fully, staffed even as of 2010, 2011 when we were leaving. And I was shocked to discover that for whatever reason, our fear of innovation or our fear of confronting something new, which is then ready-made, they even had a Cobus 400 machine, even then, in 2010, they refused, his successors refused to open the center until 2018. And so that was a good 7 years where this state-of-the-art center that could do outpatients, 30 rooms, treat, screen, find, treat, was not put into action until 2018. And even then, it wasn't fully put into action. I think it's when COVID broke out in 2020. I happened to read in a newspaper that they were taking COVID tests to Ibadan. And finally, I got fed up, so I called the head of the NCDC and I said, look, I don't understand why Kwara State is taking COVID tests to Ibadan when there's a Cobus 400 machine, which is the most state-of-the-art PCR machine sitting there in this hospital and it's working perfectly. So to go back to why I'm here today, and actually why I just changed everything, put everything down, and I said, I must be here. It's because every 2 seconds, a new case of cancer is diagnosed. So that means that since I started addressing myself to you, over 30 people have been diagnosed with cancer, and it's a disease that's absolutely life-changing. By the end of my remarks today, we might have had 1,000 new cases. So cancer remains the leading cause of death worldwide. It accounts for 1 in every 6 deaths, and the statistics prove that almost everybody in this room today is a survivor or knows someone personally that has been affected or sadly taken away by cancer. Cancer is a personal story for all of us. I remember the days in Nigeria where people wouldn't admit that they had cancer because it looked like a curse or a scourge. In fact, the only favor HIV did for Nigeria was that when HIV arrived, it was so stigmatized that people started to admit that they had cancer only to prove that they did not have HIV. February of this year, I lost a very close friend of mine. In fact, don't let me say I lost a close friend of mine. The global health community lost an incredible activist, facilitator, functionary, and champion, Dr. Mwele Ntuli Malesela, to cancer. She was a passionate advocate for eliminating neglected tropical diseases as the director of the WHO's first ever department for the control of NTDs. And in case you want to know what NTDs are, so NTDs range from worms to leprosy, which we still have in Nigeria. She was also a highly respected scientist, and she specialized in lymphatic filariasis in Tanzania. She was a truly inspirational figure for young women in science and a dedicated leader and committed listener. So I'm sure that wonderful words can be said about every person that you're currently thinking about, how their diagnosis, their treatment, or their passing was felt so deeply and so personally, and that their warmth and their inspiration continues to serve as a guiding light for why we're all here today. Now, cancer is a cruel and silent disease. When I walked into this room, I don't know, I was attracted to one person. And so I just looked at her. I think I liked your haircut. So I nodded at you. And I had no idea from looking at your face or your expression that you were going through that journey. So it doesn't show on your face until it's quite far gone. And it doesn't care about your age, your gender, your status, or even your personality to be diagnosed with it. But to be treated for it, cancer cares about everything. The equity gap within cancer care is costing lives. And I will tell you one thing, a life that is lost, the value of that life can never be quantified again. People who seek cancer care hit barriers at every turn. The barriers of income, education, geographical location, and discrimination based on ethnicity, race, gender, sexual orientation, age, disability, and even lifestyle. Then you have the barrier of the cancer care infrastructure and the deficit of specialist nursing and midwifery workforce, which are just a few of the factors that actually do negatively affect care. The most disadvantaged groups are also more likely to have increased exposure to other risk factors like tobacco, diesel fumes, an unhealthy diet, or environmental or even workplace hazards. So it's almost guaranteed that the gap actually does affect you or someone in your community if you were to look hard enough or listen hard enough. We can, however, close the gap. The reality today is that who you are and where you live could mean the difference between life and death. And it isn't fair. But we can change this. We have to bridge the gap, and we do have to support organizations like Bricon in their admirable work at the front line in people's households and families to make the lives of people who are experiencing cancer and their families better and together, and to strive to make a difference in the cancer care landscape in Nigeria. Nigeria suffers from very high morbidity and mortality of cancer, with a 60% death rate today. The rate is disturbing and it's extremely high. But by improving the gaps that exist throughout the cancer care supply chain, from policy to health system capacity, from screening and early detection to financing treatment, as Abigail has said, and also to improving the available workforce in cancer care to cancer survivors and family support, I think we could, with that amount that you have calculated, support about 40% while we raise the overall cancer survival rate. Now, according to this massive document which I brought along with me, which is actually the Wellbeing Foundation Africa and Amref Health Africa's landmark 2018 Rapid Assessment of Cancer Care in Nigeria, which actually did guide Nigeria's policymakers in formulating the National Cancer Strategy and registries. The burden and trend of non-communicable diseases, including cancer, is on the increase in Nigeria, and it is instructive that this research was not supported by any domestic resource mobilization whatsoever, not even one naira. It was supported by a Japanese company called Takeda, who somehow sought myself and Amref out. Amref don't even work in Nigeria, and said, do you have the courage to count how many machines in Nigeria are working and how long it takes to get treatment and what are the challenges and the barriers. And those who know me from childhood know that I'm actually a very stubborn person. So whenever anybody says you can't do this, in fact it's that thing that they said I can't do, that I actually set my mind to. Now we found that most states in Nigeria have only one officer in their Federal Ministry of Health NCD unit, who rarely comes to the workstation, because we all know that teamwork is easier when you share a challenge. Now there's 206 million people in Nigeria, and 22% of that 206 million will encounter cancer. That's the global rate. But most states have one officer in the Federal Ministry of Health to plan, to think, and to implement what each state is going to do about cancer. Primary health centers have functional referral systems. They do. If they see something that they can't deal with, they will refer. But they don't have the capacity to screen or to make a diagnosis at that level. The treatment in those facilities is far from optimal because of inadequate financing, insufficient equipment, and the low level of technical know-how in dealing with cancer. The supply chain of drugs and commodities are also extremely expensive, leading to the majority of the population experiencing an immediate financial barrier to treatment. So the report showed us that at a stakeholder level, the awareness of cancer was low, and according to the health workers, most of the patients present themselves to the health centers when cancer is at stage 3 or 4, when nothing much could really be done with what we have available beyond palliative care and counsel. And even that palliative care and counsel shouldn't be taken for granted, because even that costs. Now, I know some people are saying stage 3 and stage 4, and so you might just be thinking that's something that's detected in a lab test. But let me be honest with you. The first case of breast cancer that I encountered as a first lady was a lady that came to me. Her name was Alaja Labelewe. I can never forget her name. And she said, I have a wound in my breast. And the cancer that she presented in front of my eyes was not something that needed a lab to detect. It was an open wound the size of my palm. And she had been covering it beautifully for years. At the point that she showed it to me, of course I swung into action and did my best. She had just 3 weeks. So the only consolation was that she didn't die in pain. She was able to say goodbye to her children. The cancer care landscape in Nigeria is compounded with an acute shortage of professional health personnel due to the ongoing brain drain of health personnel to high-income countries. For example, clinical nurse specialists in Nigeria are long overdue for the development, recognition, and legal inclusion of the midwifery and CNS roles and practices in the career structure of nurses at all levels of the health system and the midwifery services framework. Very few people know that there's one particular cancer that can arrive with pregnancy. And if you don't have an ultrasound where they spot the bubbles in your placenta, as your baby is growing, so's the cancer, and they won't catch it. Sometimes a woman has the choice to save her life or to continue with the pregnancy. It's a really difficult choice as a mother to make. So in collaboration with national and international partners, my Wellbeing Foundation Africa's Cancer Alliance is now committed to taking a step further from research and to formulating a roadmap towards an important push policy that will train, recognize, and remunerate advanced degree nurses and midwives in clinical settings like those which the Bricon Foundation is working in with an appropriate salary scale to establish standards for CNS role and practice and to develop actually our own Nigerian CNS curriculum with master's level courses that should include opportunities for content-specific clinical experience such as specialist training for cancer and oncology, nursing and midwifery. The Bricon Foundation does recognize that lack of sufficient support structures, counseling and advice, equipment, financial assistance and trained medical personnel to cope with the ever-increasing numbers of cancer patients. So while screening and advocacy continues to bring cancer patients to the fore, the treatment and support structures cannot cope, actually, with these rising volumes. So there is a need to address the different areas of cancer care to ensure that patients who are found to have cancer have real choices of where to go to receive care and, most importantly, can afford to either pay or access financing to have this care at all. We must advocate together to the National Health Insurance Scheme to include cancer within the essential package of care. We can't overemphasize the importance of having the relevant medical infrastructure within the country, supported by well-trained, motivated professionals and appropriate legislation. Without the legislation, we would not be sustainable. Now, this can only be done if there's sufficient funding for the medical sector as a whole, and if there are funding mechanisms to make more common foundation. Today, in 2022, the Bricon Foundation is raising awareness about cancer through education, advocacy, counseling, caring about the emotional well-being of those with cancer, and supporting fundraising for treatment, equipment, and training, which are all new. So I'm prepared to support the Bricon in their commendable work to make sure that cancer patients, survivors and their families are supported in all stages of this disease by contributing to the Bricon Foundation's target of raising 50 million naira so that we can support. Joking. So again, I presented myself there with yet a fashionable, not just to talk about healing cancer and finding cancer and treating cancer, but actually to work towards finding cancer, treating cancer, and doing so quickly enough so that our people can have a quality of life. If any of us ever thought it wasn't possible, all we have to do. So I do call on everyone to support the smaller organizations and work with them to keep them alive, while we will also talk to the giants to try to reduce the cost of cancer treatment. And then we do need to talk to Big Pharma to see how they're going to get the medications to us and continue to evolve those medications so that they are more effective, they're easier to take, they're easier to administer, and they work more effectively. Consider me a partner. Thank you very much.
Thank you so much, Your Excellency. I would now like to ask...
Thank you very much. Your Excellency, Mrs. Saraki. Medical doctor himself, saw the need towards creating that state-of-the-art diagnostic facility when he was governor. But not too many of his contemporaries did the same. And the truth is, the attention of policymakers in Nigeria is centered towards what they can get. As we are sitting in this hall today, basically every state in Nigeria has a state health insurance scheme. But the secret, the catch there, is the fact that it only became necessary when the National Health Act was passed into play, and 1% of the consolidated budget is going to healthcare. And it became imperative that you cannot assess the fund if you don't have a state health insurance scheme. And that was the reason why all of them rushed to form state health insurance schemes. Now, that tells you something. If the goodwill is not there, the money will not get to the appropriate quarters. And even at that, cancer care is only skeletally covered, even by the National Health Insurance Scheme. The Cancer Access Program, operated by the Federal Ministry of Health in collaboration with one of the big pharma, where patients pay 50% of chemotherapy, is still not working. It's not working. So when we look at the statistics, it becomes very, very scary. According to the recent Global Cancer statistics, where over 124,000 cancer cases were recorded in a particular year in Nigeria, over 70% died that same year. When you say 124 and over 70,000 died, it means over half of the total number of cases confirmed for that year died. Why? Because of late presentation. And don't forget, for every cancer patient that is documented, even at late stage, there are hundreds out there that have not reported to the hospital. When you come from an environment like mine, I come from Yobe State, northeastern Nigeria, where cancer is like a taboo. They have a special name for it. It's not only cancer. Things that are ordinarily not cancer will progress to cancer because they will tell you, don't go to the hospital. If you go, they give you injection, you are gone. And before you know it, that patient will not go to the hospital until when cancer has advanced. And again, we still come back to the same cycle. Her Excellency was talking about the paucity of manpower. It's not only the paucity of manpower, the paucity of equipment needed in our facilities. Screening facilities are lacking. Radiotherapy facilities are lacking. In Nigeria, with the population that we have, we should have at least 300 radiotherapy machines. As we are sitting here today, we have less than 6. Out of these 6, maybe only 2 or 3 will be working. There are patients that have tried their best to go to the hospital, and then they are now at the stage of radiotherapy. Somebody that has not gone beyond the shores of Yobe State, for the first time, they will tell him, you need to go to Lagos for radiotherapy. That patient, just like that cancer patient that was screened, found out during screening, and she disappeared back to the village, that patient may likely just go back to his village, and you will never see the patient again. So we all need to come together. I am saying this because the rationality behind crowdfunding is very important. When 10 members of a family gather to contribute 100,000, it's easier than when the richest of them brings out the 100,000. Because inevitably, one day, it will all go around. We may contribute 100,000 to help this one today. Tomorrow, it may be another person's turn. So it's very important that we key into this concept of getting resources to help patients that are in need. I am happy with the stories I have heard from champions, from survivors. I learned the first person to talk to us here is a 13-year-old. And she was diagnosed to have breast cancer. She was lucky. She was very lucky. One, she's in Lagos, and she was lucky to have been directed appropriately to the right people. I have so many engagements. I was supposed to be in Lagos last week. I couldn't come because I am president of the Nigerian Cancer Society on voluntary basis. I have my primary work as a clinician. But because of the character of the individuals involved in this process, Mrs. Abigail Simonat and my senior brother, Dr. Nee, if I tell you the testimonies people are saying about them, it will make you to love them more. Because anybody I speak to will say those people, they truly know their onions. They know what they are doing. Why? Because they are doing it the right way. Let me open up to you. Cancer patients, not only in Lagos, are benefiting from the benevolence of these individuals. Recently, I don't know whether you were part of the picture. That time, there was a certain 16-year-old girl that was brought to my attention from a Facebook post by a surgeon who had difficulties, finances, counseling, and what have you. She had stage 3, I think, colorectal cancer. Somebody brought it to my attention on Facebook, and before you know it, when somebody in Abuja said I should contact the doctor, let them see what they can do. When I contacted the doctor, before you know it, coincidentally, the doctor, we thought the patient was in Bauchi, not knowing that the patient was actually in my state. Because the doctor used to come a week, every month for locum. We call it locum, like a part-time distance. So when I was trying to connect our people in Bauchi to go and meet with the doctor, he said, "Doctor, the patient is in your state." So I had to go and see the beauty of good people everywhere. Somebody from US, right there, and then said, "You cannot go there empty-handed. I'm sending you 200,000 naira." And within 2 hours, she activated mechanism for somebody here in Lagos to send 200,000 naira. Another organization, you are aware, from here, Lagos, said, "Tomorrow we are sending consumables, colostomy bags, and what have you. Things that you don't get around there. Because you will be using nylon after colostomy. This is somebody now using colostomy bag, what they use in the ears." So what I'm saying in essence is that monies realized from this fundraising may not only benefit people in Lagos. The Nigerian cancer community is one family. And wherever we see the need to make referrals, we do. Lagosians alone can raise this amount. I hope and pray, just like you said, Mr. Abigail, that this target may be doubled or even multiplied by 10. It's doable. It's doable. So at this juncture, I truly want to appreciate Bricon for organizing this event. And I appreciate Her Excellency for truly honoring this invitation. And in her usual characteristic manner, she was there, she was here 5 minutes to time. Thank you very much, Your Excellency, for always being on time. We are very much aware of the wonderful work you are doing, and the Nigerian Cancer Society will always be proud of your achievements and will always be there as a platform to partner with your organization towards a better healthcare in Nigeria. And on a final note, I truly want to salute the champions that are in this room and to truly appreciate Bricon for what they are doing. There is something I noticed when we were taking pictures outside at the beginning, when they said the champions, the survivors should come out. Something that strikes me very well. They were all looking happy. They were excited. Nobody was frowning. Nobody was frowning. And we have a sizable number of them in this room. One of the board of trustees is a cancer survivor herself. The co-founder is a cancer survivor herself. 2 of them, you know, in fact, by extension, we can say all of us are survivors. Because like Her Excellency said, cancer should be everybody's business, because if it affects one person in the family, it affects all members of the family. It affects the whole society. So we should all try and chip in. We should all try and be part of changing the narrative. Because sincerely speaking, we have to take ownership. Government may not be too serious. Yes, government may not be too serious to address this monster. there is something we call Cancer Health Fund. Cancer Health Fund is a creation of the federal government to cater for those patients that cannot afford care for the three commonest cancers: breast, cervical, and prostate. For 2 years, monies were appropriated by the National Assembly. 1 billion naira gathered. 1 billion naira gathered. For 2 years, they couldn't spend this money. And we were very lucky that National Assembly didn't remove that budget cut. When enough noise was raised by cancer advocates, they started some level of implementation by enrolling patients. Even at that level, we were skeptical. You can also say you are going to cater for indigent patient who doesn't even know how to read or write, and you are sending online form for patients. You don't really want to implement this thing we told them, because if you want to implement them, you know the people that are working with the actual people that need this money. You don't want to work with them. Agreed. You are sending online for, okay, somebody's brother will feel for somebody's brother. Where is the criteria that you are going to use in selection? Well, on paper, they said they are implementing, but as the president of Nigerian Cancer Society, I have not seen a single patient that has assessed that money yet. So it means we have to take ownership of our health. We have to be our brother's keeper. We have to key in to this kind of great, massive campaign to make more cancer patients happy. The same way we see all these survivors in this room today smiling to us, coming to talk to us confidently about how good they feel, the way Bricon helped them navigate through their ordeals. We appreciate you so much. Thank you very much, and thank you very much.
Thank you very much for that very passionate speech to our president of the Nigerian Cancer Society, of which Bricon is actually a member as well. This is the fun part. Our team got together to create a logo and a campaign slogan. So what we're going to do is that we're going to unveil the slogan, the logo, and the hashtag, and then we created a rap. And it was when we were talking about it, we came up with "If it be you, it can be you." And in one of my inspirational moments, I wrote out lyrics for a rap. I don't rap. And at one point, we seriously thought we were going to have the sisters rapping. They were already, but thank God for Miles Oladimeji, who is a wonderful, young, talented rapper stroke podcaster, put together a rap song for us. And we're really excited. It's very catchy. We've been blessed by the support from Cool FM, Nigerian Info, and Wazobia FM, who will be supporting us with playing it online. And so I think we will do the unveiling of since that is what is going to get the song out. So we'll ask Your Excellency if you'll join us at the front, along with the high table, and Oluf, if you can join us as well, Mr. Rahim. We'd like to take a photograph with the unveiling of the slogan and the logo, after which we will get a message from Oladimeji before we go into our full-blown rap song. And my new rap name is Ibatra. There is supposed to be the music on the TV. Is that sorted? It's already there. Okay, perfect. So we'll do the unveiling first. Then there's a video that has to go before the rap song. And then,
We should unveil together.
yes, we will.
Yeah,
How are we going to?
okay.
Antonio, first of all,
So what do we say? What do we say as we unveil?
He's too tall.
Will you stay here, ma? And then I'll stretch my hand to the front.
No, we need to see you as well.
No, you see me.
Okay, so I think, are we going to do it? Are we going to do it on a 3?
Yes.
Is it facing the right direction?
Hi guys, my name is.
Wait. So we're going to unveil it on 3. 3, 2, 1. cancer
nice.
does not discriminate. And if it be you.
If it be you.
So we will have to cut this away now so we can watch the video. So we're going to play the video from Miles. Do we have sound?
Hi guys, my name is Miles Oladimeji, aka Oladimeji, and I'm the proud creator, rapper, producer, I guess, of the ECBU song for the Bricon Fund. The reason why I decided to go along with these guys and be a small part to such a great foundation is because, honestly, there's great potential here. When Nigerians put their minds to something, you've seen all over the world, we knock it out of the park. So why not cancer as well, you know? A lot of people that I even know of in Nigeria are dropping dead before the age of 30. It's because of underlying issues that they don't really, you know, seek out healthcare for or know about. And this is because, you know, healthcare in Nigeria is not really sought after until the donate, you know, help us out. Because honestly, you see Nigerians achieving great things all over the world, you know. Let's beat cancer as well. Let's be the nation that finally does it, you know. So thank you guys. Enjoy ECBU and donate. See you guys later.
Okay, can we have our song, please? Don't worry, we have it on my. If worst case, no, we use my phone on Bluetooth.
Yeah.
Now Bricon Foundation, Bricon Foundation.
See they sit down for your body and just they wait for the day when you know they contemplate. It go for your hand or that of your mate. Not to end them and donate. Yeah. If it be your mama, if it be your papa, children serve, cause I know they said, make you help us make this cancer end. Now Bricon Foundation, they make this call. Cause together we go help cancer fall. Cause next time if it be you, if it be you, if it be you, if it be you, cause now Bricon Foundation, they make this call. No donation, go there too small. Cause next time if it be you, if it be you, if it be you, if it be you, or more cancer. That thing with the trouble all. If you get small chance, I beg help us go donate. Bricon Foundation. If it be 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 you, let's go. If it be Bricon Foundation. Bricon Foundation. Bricon Foundation. Bricon Foundation. Bricon Foundation. Bricon Foundation. Bricon Foundation.
What we wanted to do is that we wanted to go live with the hashtags. So everybody has a mobile phone. So if you can just post that on your live on your phone, your Instagram, your Facebook, your WhatsApp platforms, whatever it is. We'll give you 1 or 2 minutes for that. Another thing, this is also what we're trying to do is that a lot of this is an online event, and we're not putting pressure under anybody to donate now. But if anybody wants to donate, there is a POS machine. There's also short codes for banks. There's transfer capability. So there's different. The scan does work. So that will take you to the donate page. We have PayPal. We have a GT Bank short code that doesn't charge you
somehow, from somewhere, somebody comes with just exactly what we need. And if that is not what God has done, then I don't know that there's anybody else we can thank. So that is the first. Secondly, we do want to thank the Nordic Hotel. I'm so pleased to have seen where they are, because they do hide themselves quite a bit. But they have given us this venue, and they have given us refreshments free of charge, and we really are extremely grateful for that. Thank you. Next, I want to thank Her Excellency, Toyin Ojora Saraki. She, I know, has been very, very involved in all these kind of things herself, but she still has taken the time out of her schedule, and I know how busy she is, to come and support us. And we are really, really grateful to her for that, because she has highlighted so many things. And in fact, I think the speech she gave was really, really very enlightening, and I hope that you all felt this, because I certainly did. I was so impressed with what she has done, with the facts she has been able to find, and the interest that she really genuinely has. Because so often one is used to people just talking, but Her Excellency doesn't just talk, she does. Then I have to thank Olu Rahim. The gentleman is the Trade Commissioner for Finland in West Africa, and they have been a great support to the foundation. Now again, there is to some extent a personal thing there, because Abigail's mother was Finnish. Although she became Nigerian, but she was born in Finland, and that was where she grew up. So there is a connection there, and we are grateful that connection has helped us to do things. Dr. Al-Hassan Umar, who gave you a very interesting talk, and I think we all enjoyed it very much. He is the president of the Nigerian Cancer Society, which I actually thought was a governmental society. But it's not. It's not. It is an NGO just like the rest of us, fighting just as we all do to try to do something in this country where the government doesn't always seem to do anything. Then we have Femi Obong Daniels, GM Corporate Affairs for Cool FM, Wazobia, and Info Nigeria, which I know many of us have pleasure in listening to. And they have thrown their weight of these great brands behind our campaign. And that, of course, means that we are going to be able to have it out to the greater community, so that there will be help coming from there. So that is invaluable, and we really, really do appreciate that very much. Mrs. Claude Nader, she is not present with us here today, but she is the president of the Lebanese Ladies Society, and she has been a tireless supporter herself and her society. As you have heard, they have helped enormously, especially with the education of the children who have not been able to continue in school because of their mother's sickness. So what they have done for us, and they have done it consistently throughout, they have been very, very much helpful, and they have been nice people too, to invite us, to come to us, and whenever we have some really big problems, they have always been there for us, so we are truly grateful. Then we have Carla Chidiak Nojim, who is sitting over there, trying to hide. Help with Carla on Niger FM. That is what she does. And she has been out-to-go person when we need for favors. And I know she has had programs with Abigail on the radio, which have been very enlightening. And I think a lot of us have enjoyed it very much. And we hope that she will continue to give us that support, because it's really appreciated. Thank you. Patty Chidiak from the Alexis Galleries. She's not here with us today, but she again has been somebody who has been very supportive. She has taken us some of her pictures. She has helped us with getting the money from sales of pictures and such. And she has also helped us in many other ways. She has been really supportive. Thank you. Dr. Ngozi Onya. Dr. Ngozi Onya, is she here? That's you? Okay. She is the MD of Palon Memorial, and they donated for us an ultrasound machine. Now, when I say that sometimes God brings us the right person just at the right time, we were looking desperately for that. And we were looking for a second-hand one because we knew we couldn't afford it. And then they come forward and they donate it to us. And that was just so wonderful. Thank you. Then we have Mrs. Mamta De Bruyne. Yes? She is the president of the Rotary Club of Eco Atlantic. And that association is another club, I would say, association. Has given us a lot of assistance, and I know that they will be able to help us and support us going forward. Sorry, I should have mentioned when we said about the Lebanese ladies that they have actually already donated 2 million naira to this. Sorry, I skipped that one. Then we have Femi Wright. Is he here? Femi Wright. Wise Associates. Oh, yes. Wise Associates, our auditors. Of course, I know he couldn't make it. But they have been our auditors from the inception, and they have never asked us to pay for the audit services that they are providing for us. And as you know, that could become an extremely expensive thing. And on the same line, we have Sandro Olajide Oyewale. That is our firm of solicitors, and they are also doing it for pro bono. They are friends of ours, and they have helped us enormously. And they are giving us advice, they are giving us free legal representation, and this is also one thing that, you know, the friends that you have, you use them when you have to. Then we have Mr. Bisi Otukoya. No? Support for our maiden training programs. I think Abigail mentioned the training programs we are doing. We are going to be doing more, and we are very happy to have the support from him for those programs, because they're really quite essential. You need the people to come and be educated, because nurses and doctors, they may be nurses and doctors, but they don't necessarily know how to deal with cancer patients, especially cancer patients that are in the later stages. So this is really important that they are being given that knowledge. Arise News are covering this event, and we are really grateful for that, because we hope that that will mean that this is an event that's going to be out there and that people are going to know exactly what we are doing, and that will help us to raise money. Then we have, of course, our campaign team, Bashir Sadiku of Bass Creations, Damola Dada of Big Band Productions. I think they were the ones who did the music.
So Baz helped with the logo and all the printing. Corinne helped with all the media-related stuff.
And there's more. There's Margaret Dukuli, Blessing Kalu, Olushola Akpapu.
All of them. They're trying to hide behind there.
All of them hiding down there.
Stand up. These are our tireless team who have been really working around the clock, hanging things up and running up and down everywhere.
Then we have Laila Johnson Salami for all her connections that have helped to make this event more exciting. As you know, it's not only what you know, it's also who you know. And you need to get the right people together for this kind of an event, and she has been invaluable in doing that. Finally, Miles Oladimeji, who is the one, I think, who did the words? Yeah. And turned them into a rap anthem, which I noticed was very popular, because I saw everybody laughing and dancing away. And I hope this is going to be a catchy tune that everybody's just going to be singing. So all of you that took time to come here today, we are really grateful. We thank you so very much. We hope that you will help us to reach our goal, but we also hope that you will talk to others about what we are doing, so that they too will know that this is a cause that is not only well worth doing, but being done by people who really are very dedicated to it. So thank you very much for coming. Thank you for listening to us. And I believe that there's some refreshments there for those of us who would like to have a cup of tea or coffee. And then I hope that you all get back safely, because I understand that there's a big event going on at Onicon. So I hope you get home safely and within a reasonable time. I live around that area, so I'm worried.
There's one final thing on the agenda, and that is the closing prayer. I think we all need prayers getting out of this traffic. So I'm going to ask Blessing and Shola to come and just give us the closing prayer.
Let us pray. In Jesus' name, in the mighty name of Jesus. Precious Lord, we thank you for this wonderful event. We thank you that at the end of it all, we have the full cause to glorify and bless your holy name. Thank you for everybody that came out here. And we thank you because we know that we'll get these funds and more in the mighty name of Jesus to help people going through the journey. Father Lord, we return all thanks to you. We bless your holy name. Father Lord, we commit ourselves unto your hands that we are going back home. We pray we'll get home safely in the mighty name of Jesus. Thank you, Father Lord. We bless your holy name. In Jesus' mighty name I pray. Amen.
Thank you, everybody. There's nothing to
How are you doing? It was very nice to you. Oh wow, that's good. Bring us a good club. Your love, yes. You were there? I will send you my details on WhatsApp, whatever is it. Doing very well. We had to go through a lot to do whatever we did there. And the government and everybody was there. Yeah. Oh, you are the president? I think I know.
Yes, so
Yes, let's take a picture. Go to your remarks. Somebody can you help us take a picture? Okay.